Hello, this is Dr. Hatemi with the Veritas Podcast. We have a special guest today, Karen Erikson. Karen is bringing 48 years of experience in healthcare, insurance, and management of healthcare facilities and practices. Welcome, Karen.
Absolutely.
We're going to have some interesting conversations today. We're going to talk about a lot of things, mostly the monetary side of the healthcare, the insurance policies, how doctors and services gets paid, and what's going on in the kitchen of the business. A lot of questions. I think it's a part of the healthcare that's misunderstood. A lot of people do not know how insurances work, how co-pays, co-insurances work, how doctors get compensated, and who are the major players. So we're going to use this podcast to enlighten people. So Ken, tell us about yourself. You have been in this business a very long time.
48 years. My name is Karen Erikson, and I have been in this field 48 years. I started out as a nurse back in the olden days, and when I was with the Department of Mental Health, and they sent us to LPN school because they didn't have enough nurses, so I did that. And then I said, I don't want to do this. I want to do something else. So I went into healthcare administration. And so that's where I am. I have also a certification from the American College of Medical Practice Administrators, and I also have a fellowship. So I have a lot of experience. I have worked for large organizations such as Palmetto Health, Richland Memorial, FICOR, which was Carolina Primary Care, which we had over 60 physicians. Also in Savannah, St. Joseph Medical Center, Memorial Medical Center, and then I've been over Ambulatory Surgery Center, so I have a variety of experience. And there's probably not anything that you could ask me that I haven't been through. That's the scary part. So that's when you know, Dr. Hatemi, it's time to retire. It's when you know that you've been through everything and there's nothing else to go through. But so I would like to start, if you don't mind, just kind of telling people about health insurance. And I hope you don't mind, everybody. I had to put on my glasses because I'm totally blind. I can't see. But healthcare companies and healthcare insurance is a very, very complex. Everybody thinks, oh, well, you accept my insurance, so I'm fine. But it's not. It's tricky, and navigating through this healthcare system is so complicated. It's complicated for us who've been in it for 48 years, and with the federal laws and the national laws and even the rural. If you're in a rural county, they have their own, and I don't think that people know that you can actually have insurances that covers your region and not out of your region. So I don't think people know that, and how it's covered, and the pricing and the availability, and how it is from state to state and county to county. So navigating this complicated world of health insurance is very confusing, and I understand if you're confused, and we want to try to help you. We want to help you understand us. We want to help you understand Veritas. So if you have any questions, we're opened up. Dr. Hatemi will let you have an email address, hopefully, that you can, send us some information if you have a question about Veritas. If it's about your insurance company itself, my suggestion is you call your representative. They know your health care plan better than any of us, because a health insurance company versus a health insurance plan are totally different. Your health insurance company has several plans that's underneath them. So you may be in one of the plans that unfortunately Veritas is not in contract with. So you need to know the difference between the insurance contract, the insurance company versus the insurance plan. So hopefully we can clear some of that up for you tonight.
So we get a lot of complaints from patients about we are refusing to see them, or we cannot see them because they don't have their insurance card with them. What's the significance of bringing your insurance card with you to a doctor visit? Because a lot of people have a misconception that they got to be seen and we are obligated to see them even if they don't have an insurance card. Is that true?
No. It's not true. Let me explain to you, being in the healthcare field for as long as I have, it's your responsibility as a patient to have your insurance card on you. I know for a fact, and I've worked with Palmetto Health, Richland Memorial, and hospitals, and the FICOR, which was a nationally known organization. You have to have a copy of your card. We don't have to see you without a copy of your insurance card. So that is your responsibility. It's your responsibility to know what your benefits are, what they will pay for, and what they won't pay for.
And we are not obligated to see, and we cannot look up the website and do the work for you. It's the patient's responsibility to bring their insurance card.
We honestly try to do that, Dr. Hatemi, but there are times that either we're not allowed to the portal, like if you're out of state or if you're out of our network, sometimes they won't have that patient listed on the portal. So we can't look it up and see what kind of benefits you have. So it's important for you to know as a patient what your benefits are. Don't just look and say, oh, Veritas is in Aetna network. Yes, we are in Aetna network, but we may not be in your plan, and that's the difference. An insurance company is different than an insurance plan.
There's almost like intentional, like insurance companies try to confuse people about where you can get services. I mean, I know we are a little clinic, small clinic, but like even the biggest hospitals have problems. Like right now, Prisma has a lawsuit with United Healthcare. They're having issues. So it's the biggest healthcare system in South Carolina is having an issue with the huge insurance company just over something similar to this, you know.
Exactly. And that's why it's very important, again, and I'm going to keep stressing this probably throughout the whole entire podcast, that is your responsibility to know what your plan offers and what your plan will pay for. Do you have out of network? Out of network means that Veritas, for some reason or other, is not in that network plan. They may be in the network of Aetna, but not in your network plan. And there's several reasons for this, and we will get into that later. But so it's really important that you know this. And yes, and the hospitals are also having this issue. Everyone is. And that's why I think the healthcare community, because I'm part of MGMA, which is the medical group, healthcare group of United States actually, and South Carolina, and we all having this issue, and we talk about it at our meetings, that patients need to understand and be educated. So educate yourself, because with your education and our education, then we can work together to make it work for all of us.
Absolutely. So when somebody comes with the insurance and they have a big deductible, then that means that up to that deductible, they are responsible for it.
Correct.
Why when people, and they say, okay, our policy, which is changes from clinic to clinic, we ask for $100 up front and then we bill for the rest. And a lot of patients get upset about it. They say, like, why you don't bill me for the whole amount? Why we don't bill people? I know the answer, but I want to ask you why we don't bill.
There's two answers here. First of all, each individual physician or practice versus hospital, private practice, whatever, has a contract with the physician. And the physician and the insurance company negotiate their rates. I promise you that the insurance company is not going to pay us any more than what they want to pay us. Okay? So it's a negotiated rate. So take, for instance, another urgent care. I won't say which one, but let's say another urgent care in Columbia just says, oh, this is all we need to collect. That's their policies and procedures. That's fine. But our negotiated rate may be totally different. So you need to pay that deductible or whatever you owe, because we're not going to try to collect more than we should at any time. We have to stay within our boundaries. We have a contract with the insurance carrier separately than the patients do. So you have to understand we must abide by our contract, because our contract has nothing to do with your individual contract. Our contract has to do with that insurance company, that insurance plan, and if they tell us to collect it, then we have to collect it. If you met your deductible and we go online and we see that you haven't met your deductible, then we're going to collect that money and then we'll have to refund you.
And we don't determine the copays. I mean, the insurance company dictates the copay. So when I charge you $50 or $75 and $100 copay, trust me, that's not my choice. I actually rather not collect the copay and get paid by the insurance company for the 100% of the visit. But insurance companies want some payment from the patient, and I'm legally obligated to collect that.
He's legally obligated. I'm going to say this because you've had this, we've had this so much. He is legally obligated. It says in our contract.
Yep. So I cannot do a favor.
I'm the one that sees the contracts. Trust me, I'm the one that signed these papers. I know. We are obligated. If you have a copay, a co-insurance, a deductible, we are obligated to collect it before you are seen for your visit. So that is the rules, and we have to abide by the rules or we can get into trouble.
And the reason for that is if you forgive or you overlook a deductible, say a copay, like say you have a $50 copay to see the doctor, and if I don't collect that $50, and some doctors in the past might have done that as an incentive, that's insurance companies actually frown upon and actually persecute that cases because they think that's first of all, that's supposed to be a deterrent for patient to overuse healthcare. So if I forgive your $50 or I don't collect that copay, they feel like I'm moving the deterrent, so making it more accessible, which is kind of sad, but it's a fraud in their eyes. Also, that $50, they want me to collect because if I don't collect, that's categorized as a kickback to the patient. So technically it's an insurance fraud. You can get away with a couple of cases, but in a large scale, that will be insurance fraud. So I cannot say patients, today is special day, special month, October, no copays. I'm running a special. If you come to my clinic, I'm not going to charge you any copays. I cannot do that. It's actually illegal. Insurance company will be mad at me and come after me because I'm removing the deterrent. Absolutely. And it's a kickback to the patient. It looks like I'm incentivizing them to come back to my clinic, and that's actually insurance fraud.
And the important thing for patients to understand is that an insurance carrier is a business.
Yep.
Our healthcare practice is a business, just like a store, Target, Walmart, wherever you want to go. You go to them, you may see one price. You come to us or Target, you may see another price. It's just the way it is. We are a business. Insurance companies are business. And insurances, I hate to tell you folks, but they're in there to make money. They're in there to make money. Now, do we make the money? No, we have to write a lot of that off because we have a contract with them. We have a discounted rate, and that you will see that. A lot of times we have an adjustment rate, and you should see that on your EOB. So just remember that what they said we have to charge is what we have to charge, and what we have to collect is what we have to collect. But this is a business. This is what insurance companies are. This is what healthcare is. Yes, Dr. Hatemi is wonderful. He wants to take care of you. And I'm appreciative because there's a lot of doctors out there now that are not seeing patients. So therefore, you got to take a little bit of responsibility on your own.
Absolutely, and it's a complicated business. We write off a couple $100,000 a year. I mean, we run a huge loss for people who doesn't pay their bills, unfortunately, especially when the economic times are getting harder. We are getting into a recession. We're going to see more and more. Surprisingly, right now, it's a state fair in downtown. And everybody said, why did a doctor cares about the South Carolina State Fair? It means a lot for healthcare. First of all, that's the time people don't pay. Believe it or not, they use their cash. They go to the fair first and they spend their money. And then that's when they overlook their hospital bills or their clinic collections. And also, that's the time we see the most patients refusing to pay their co-pays. It's so interesting how the dynamics of our society works. Tax time is the best time. When they get their tax refunds, we get...
unless they're garnished by Lexington County.
Yeah, yes, tax returns can get being garnished by Lexington Medical Center and Lexington County if you don't pay your hospital bills. I think they don't do that anymore, right? Or
I'm not sure.
Supposedly,
I think it's still in the works. I don't know. I heard it's still in the works. I think they're trying to vote against hospitals doing that. But I'm not sure if it's been resolved yet.
But you need to be a state affiliated hospital, like MUSC can do that. Lexington Medical Center,
government funded, yes, sir.
Government funded. So Lexington Medical Center qualifies.
I think they do qualify for some government funding. I can't be 100% sure, so I'm not with because I'm not with Lexington. But I do think they receive some government funding. So if they receive anything, well, even us, Medicare, Medicaid, military, VA, that's federally funded. True.
I mean, we see veterans, we have a contract, and a lot of people say, is it TRICARE? It's not TRICARE. It's not really insurance. It's more of an urgent care benefit. So if you're a veteran with a VA card, you can be seen our urgent care and without paying much. without paying anything, actually, most of the visit, and minimal fees after that, and it's covered by the VA.
We do have to have a USERN number, which is an authorization number.
Yes.
And a lot of times to see patients. A ACMPE is totally different. It depends if you're retired, if you're disabled, so that's totally different. TRICARE itself is... it will pay for some. If you have TRICARE for life and Medicare, then Medicare is your primary, TRICARE is your secondary.
Which is your favorite insurance company?
Medicare.
Medicare. Mine too. Believe it or not, Medicare pays good. Usually not many problems.
Medicare pays. At least they pay, and you know they're going to pay, and they may not pay, but I look at it this way. I mean, I look at all the insurance carriers, and honestly, they pay better than anybody as far as you're going to get your money, and they're not going to argue with you. And I'm on Medicare, and I'm 70 years old, so I can say this and be proud of it.
Medicare for all.
Absolutely.
That would make my life much easier if you had one insurance policy.
I don't know why a lot of physicians hate Medicare. I don't know why, because personally I like them, because at least with Medicare you're going to get paid unless it's something that you really haven't done or haven't done your research or haven't done an authorization. But Medicare is the easiest one out of all of them, and unfortunately I won't tell you what I think is the worst.
What's your worst? You need to tell me.
Well, yeah, there's a lot. Okay, Medicaid. Let's talk about Medicaid. Okay, so if you have Medicaid and it's Healthy Choice, and it's through the South Carolina Healthy Choice plan, you need to be really, really careful. They're a good plan, and if you can't afford insurance, absolutely you need it. So I'm not saying don't go out there and get it, but what I'm saying is for some reason that you also get a Medicaid product that is from Blue Cross Blue Shield, Aetna, Cigna, Humana, let's say I'm trying to think of them all, UHC, United Healthcare, that insurance is actually primary, not your Healthy Choice. So if you have both the Healthy Choice and one of the private insurance plans, you need to make sure that we know that, because what happens to us if we don't have that primary insurance? Let's say maybe you have Medicaid through Blue Cross Blue Shield, and if you don't bring in that card and only give us a Healthy Connections card, and we file that Healthy Connections, that claim will be denied, and then you could wind up paying for it, because urgent cares are unique. And one of the unique things is sometimes we may see you one time and never see you again. Mm-hmm. So if we're unable to get in touch with you or to call you, or you don't tell us that you have another insurance, then we're going to look for you for the financial responsibility, because you didn't tell us. So if you don't tell us the truth or present us with the card, then it's your responsibility. So if you do have Healthy Connections and then you have a private Medicaid supplement, or actually it won't be your supplement, it'll be your primary, then you need to tell us that, because we will file it. And I'm telling these insurance carriers keep up with that. You can't get over too much on them because they keep a record. So if you have both these insurances, always provide us with your private insurance plan first.
And that makes a difference, so you don't get in trouble with paying the bills and all that, because, if you don't provide all the healthcare insurances, eventually you will foot the bill, and it's an unpleasant consequence of not giving the full information to your doctor. We need to know. Don't hide your secondary insurance, because it will always come up. When we submit your insurance card, they're going to ask me, where is this primary insurance? So you cannot just use your one insurance. You need to show us all your insurance information.
Be honest, because personally, we don't want to have to call anybody or turn anybody over to collections because they're not paying. So, be honest with us, because we want to help you. We're there. He's your doctor. He's not your health insurance company. He's your doctor. So we want to help you as much as we can. So you have to help yourself. Come on, we all have to accept responsibility. So we're here to help you, but you've got to provide us with the information that you need to.
So as an advice to patients, what can you tell patients as an advice to save money in their healthcare choices? Like which clinics to use, what services to utilize, so they don't get stuck with huge bills?
Okay, well, I'm an advocate of making sure I'm covered. Okay, as I mentioned, everybody, I have Medicare. And I don't have Original Medicare. Original Medicare is your red, white, and blue card. And on that, it will say Part A and Part B. But I also have Humana Health Insurance. Okay, so my Humana Health Insurance takes the place of my Original Medicare card. So it's my responsibility, having my Advantage Medicare, to know what doctors are in network, what benefits I have. So always ask. Don't be intimidated by these insurance carriers. Ask them. You're paying the premiums. Ask them. Say, I want to know what I'm entitled to. I want to know what it pays. I want to know if it pays in network. I want to know if it pays out of network. Do I have to have an HMO physician, which is a primary care physician, gatekeeper, whatever you want to call them, or can I go out of my network? What will they pay?
Absolutely. And also, I think one of the key people do not know, there are different prices.
Absolutely.
So, you can choose to say you go to a doctor affiliated, I'm not going to give names, so a doctor works for a certain hospital. And then they say, oh, you need an MRI of your brain. You don't have to get that MRI in that hospital. You don't need to get it from anybody affiliated with that hospital. You can get it in an independent imaging center. We have Claremont, we have American Health Imaging, we have Palmet Imaging, and they're way cheaper. Even with insurance, it's cheaper. A lot of people realize, I just paid $3,000 for MRI, and the cash price for that MRI is $500. So why is that? Because hospitals charge facility fees.
Yes, they do.
And independent guys like me or independent specialists do not charge those fees. So there's a huge price discrepancy. So I would recommend people to use independent guys as much as you can.
Yeah. Look at, again, first of all, and I used to work with several practices that had our own ambulatory surgery centers. And if you've ever had a colonoscopy or your ears, nose, and throat, I'm trying to think of all these practices I've worked for where I've been over an ambulatory surgery center. One of the things that they're supposed to do is they're supposed to tell you that this is in your plan, and I always want to know what's in your insurance plan. But if you want to go to another facility, you can, but you have to make sure that it's in that the insurance is going to pay for it. Always make sure of that. But yes, they're supposed to offer you, if there's another place, they're supposed to let you know. You can go to another place, you can call, you can ask them their prices. That is part of it. So you can call and say, is this place in my network? Will they pay for it? Yes, by all means, because I've worked for hospitals, and not just in South Carolina, in Georgia. I worked for 2 hospitals, for Memorial Medical and St. Joseph, which is in Savannah, Georgia. So I've worked for both those hospitals. And I know for a fact that they charge differently. They do charge a facility fee along with other fees. So there are extra fees. So just ask.
And ask and shop around. I mean, you're not obligated to use certain services, even if you can use this specialist in this hospital and you can use another specialist in this hospital. You are not married to one hospital system. And try to use independent guys as much as possible. Like I send a lot of my orthopedic cases to Midlands Orthopedics. It's one of the biggest orthopedic practice.
Work for them too.
Yeah, you work for them too. And why do I like them? They're fast. They can see you fast. Their surgeons are pretty good, and they're independent. Independent means you pay much less than if you go to a hospital to get exact same service, and probably better service because you don't have to wait as long like you will do with a major hospital. You can see them immediately. It's a very efficient machine they built. And cardiology, same way. I mean, I still send it to the hospital, but most of my patients go to private guys because they are more cost efficient and they can get you in faster. It's more personalized care too.
I think so. Like I said, I've been involved in hospitals, and there's a couple of large practices that's in Columbia that I've been managed over. Yep. So I have to really kind of be careful because I love those people and I wouldn't do anything to harm them. But at the same time, I'm not harming them. But I know for a fact that it can be different. And I personally love autonomy. I don't like anybody telling me what to do.
I think private practice is becoming more of an endangered species because hospitals are buying them up. You know, they're on the gates, try to buy every single practice out there because
they're afraid. They're afraid.
I mean, we are threatened. You know, unfortunately, hospital systems, they have much more power. I mean, think about the billions of dollars they make. I look at MUSC's revenue for last year, $5 billion. They literally made $5 billion in revenue. That's incredible, you know. And they get.
I promise you, unfortunately, we're not doing that.
They get tax benefits. They get state funding, federal funding. They get like from the opioid settlement money. They get millions of. I mean, they get money every direction it comes in, and they can. I mean, that's why they're buying up all this real estate. I mean, like, look at like our local hospital, like buying 100 acres here and there every year almost.
Yeah, you've got to find out what's right for you. And like I said, 48 years, I've been through it all. I was here before managed care, HMOs. I was here when HMOs started. And I can tell you back then you got $10 per patient per month. I mean, I can tell you, and with a $10 copay. So you just want to make sure what is right for you, because isn't that what it's all about? It's the patient.
That's supposed to be the center of our care, is the patient or centered, but unfortunately it's not like that anymore, because it's more corporate. I mean, you came to healthcare field when there are a lot of independent providers.
Absolutely.
It was that old school doctors like taking care of their patients and making home calls and home visits. Now you are literally going to a corporation and then getting a corporate health care, not personalized. Doctor doesn't know who you are.
Independent doctors are very rare now. Very
it doesn't.
Rare. And it's sad.
I mean, I think my urgent care had been successful because we brought that urgent care mentality, but it's also personalized care, because I probably know all my patients, almost like friends with a lot of them outside of the clinic, and I already know their problems, why they are there for. I can take care of them, and it's very simple, very streamlined, and then we can get it, unfortunately. And what other topics do you want to talk about? Let's not deviate much from insurance. There's a lot to cover.
I think we've really covered most of them. It's just the way it's wording. But, like I said, go to your insurance, whatever your insurance is, because there's HMOs, PPOs, EPOs, high deductibles, self-insured, employer-insured. Go to your insurance company or go to your employer. Ask them what plans, this is covered, ask them what plans that they have that's available to you. And then when you look at this plan, find out, because one of the things that we as patients want to do, and I'm this way too, and that's probably why I went with a managed care plan, is because I had a choice: original Medicare, Part A you don't pay anything for. Part B, you do. Don't let them tease you. You do. And then if you want a prescription plan, there's Part D. You got to pay for Part D. Okay? And then if you want it covered, you got to pay for a supplement plan. And I like supplement plans, and they go from A to N.
There's a lot of them.
A to N. And they're pretty expensive if you want things covered. They can range anywhere from $200 to $500 a month. So I'm thinking, okay, if I pay them $500 a month, I'm paying Medicare $100 or $200 a month, and then I'm paying for my prescription plan. That's $600 or $700 a month I'm paying. So what am I getting for that? Or do I want to go with a healthcare plan C, which is your Medicare Advantage plans, which I'm with, and I'm pretty lucky for my age. I don't have a lot of health issues, thank goodness for that, because I spend my time at his office all the time. I don't want to go to another doctor's office, But so just make sure that you know what plan you're in. Make sure if you're out of network, are you in network? If you come to see us, which we hope you do, because you will get a different kind of care. You will get somebody who is going to give you the attention that you want. It's going to give you the treatment that you want. But you have to make sure that we're in your network. And if you don't know, call your insurance company. Don't let them intimidate you.
Yeah, insurance companies are there to help you. They're big business. I mean, they're the biggest lobbying company. They're the biggest employer in the South Carolina. You look at it in insurance companies, so they're there to help you. I mean, most of the time. I mean, at least.
Let's talk about in-state, out-of-state, because I think I think this is one of the issues too that people are having. I think sometimes you'll go online, which is a good thing, and I appreciate that. You go online and you'll see Dr. Hatemi is in network with Aetna, and I'm just using Aetna, but I can use anything: Blue Cross Blue Shield, United Healthcare, Cigna. But when you go onto these websites, look at your benefits to see if urgent care is in there, out of network or in network benefits are in there. Because a lot of people don't understand that sometimes your health insurance is centered around the region that you're in. And I'm just going to take, for instance, Newberry County. Sometimes, depends on the health insurance company, and usually it's a Medicaid managed care or Medicaid insurance that limits you to a 25-mile radius. Make sure that you know that, because then if you come to Veritas and your insurance company says, oh, well, you're out of the region because you went 50 miles instead of 25 miles, you know that we're not covered, or you're not going to be covered. So it's just important, again, to ask questions. Don't be afraid. What can they say? I mean, and you know what? You know what the happiest season there is?
Which one?
It's not Christmas. It's this time of year, though. It's open enrollment.
Yep.
If you're from Medicare or some other insurances, it's that time of year. Now, who can get more excited than a person in insurance? That it's that time of year. But with it being that time of year, or if it's that time of your year doing some January, June, July, whatever, this is the perfect opportunity, because then you can decide, is this right for me? Is this really right for me? Or is this not the right for me?
It's a complicated topic, though. A lot of people do not know how to choose, so they need a lot of guidance. Who did you go to? I mean, you know a lot about insurance. Like, where can an average person can go and ask these questions before they enroll for any insurance policy?
Well, you can go to the insurance company itself. But if you know somebody who has an agency, and I'm not talking about those people that call you robocalling, because let me tell you, those people make me so angry, because they just want to sell your product, and then they sell your product. I got to tell you this story. I got to tell them this story. So a friend of mine lives in a different county, and she's on Medicaid, and so she enrolled in a private Medicaid supplement, which is going to be her primary, because she's enrolled in this private care. She's come to Columbia for her treatment, because this is only 45 minutes away versus maybe an hour away, and all her bills were being denied. The reason why is because the person who enrolled her in the plan enrolled her for Charleston County instead of Richland or Lexington County. So her bills are not being paid. So it's little things like that. You don't think it's important, but it is. What county am I in? Because I live closer to Richland County or Lexington County. I don't want to go to Orangeburg or Charleston or Sumter or whatever. So please always know what region that they're covering. It is,
small details is the devil is in the details. I mean, they get you in those details, and you need to really carefully, because insurance companies are in there not to pay. They don't want to pay, especially private guys. So you need to figure out to play the game right. So you need to know the rules.
When COVID came about,
yes,
which was February of 2020, we know it well, don't we, Dr. Hatemi? Everything changed at that point. Even the rules changed. I mean, I was getting emails daily, and I mean daily, sometimes hourly, from these insurance companies that were trying to decide, are we paying this? Are we paying that? Are we going to pay for this COVID? Are we going to pay for that COVID? What are we going to do? And I was going crazy, and I was trying to call the insurance companies, and unfortunately, since everybody was working from home, nobody wanted to answer my call. That's why I'm saying it's really important that you do the best you can to find out what you covered and what's not covered, because things change daily in insurance. And I mean, I hate to tell you that, but I'm sincere when I say that. And annually, coding can change, documentation can change, anything can change, especially if it's a federal government. It can change. So always find out. Ask questions. And if you don't know, find an agent, or, hey, email Dr. Hatemi and he'll email me. But, whatever the case may be. But, I would rather you know. And then also, if you're out of state, it's real important to know this. A lot of times, a Blue Cross Blue Shield, like it's a Horizon Blue Cross Blue Shield, or if it's another kind of Blue Cross Blue Shield, and you're out of state, doesn't mean that you're going to be covered. Please, please, please understand that. And I'm talking about some of the students that we see.
Yeah.
You want to ask questions?
Yeah, that's actually, we are seeing in the college, University of South Carolina, we have a clinic right by there, and we see a lot of out of state, because students, when they come to USC, they bring their insurance from a different state. And we get a lot of conflict and a lot of denials because their insurance doesn't want to pay for it.
So remember that insurance can be from plan to plan and state to state, and usually private insurance is. So when you're looking and you're trying to find out, okay, I need my child to go see the doctor because they're not feeling well. So call the plan, find out, do I have out-of-state benefits? Do I have in-network benefits in South Carolina? Even before you travel, I'm getting ready to go on a cruise, so I'm thinking about, well, I need to be covered before I go on a cruise, you know. I need to make sure I have medical insurance because my medical insurance won't cover it.
So you have to get a separate health insurance for cruise?
Just for cruise. And you can get that found sometimes through the agencies.
So the cruise agencies provide you?
Yeah. So that's what I'm getting. So, but I guess because I know and I've done my research and because, you know, of my age, I really want to make sure that I'm covered. Not that I plan on doing anything, but, you know, just in case.
You know, one of the first job offers I got was to be a cruise doctor.
Oh, yeah.
To work on a cruise. That would be fun. I mean, you travel for free, you know, you have your own private room, and then, hey, I mean, what can be wrong? I mean, I hope they don't have heart attacks and stuff, but that would be, they probably do eating that much on the buffet, but it's probably an interesting job. Where are you going? Yeah.
I'm going to a lot of places. So, I mean, you know, Ireland's on my list, and my children are taking me on a cruise. So, that was my 70th birthday gift from my children.
Did you get the Alaska cruise? Yeah.
I'm still working on that one because I want to go to Alaska, and I love whales. Don't ask me. I love whales. So, if you do have a student or child that's in South Carolina or any place, it doesn't matter for South Carolina, call your insurance company. Make sure that you have outside coverage for urgent cares, and also be very, very careful because there's different definitions by insurance carrier of emergency versus non-life-threatening care. Urgent care is a non-life-threatening. If it's a life-threatening and you send them to us, it's not going to cover it. If you have a brain injury, you can't come to us, right, Dr. Hatemi?
Don't come to us if you have chest pain, you think you're having a heart attack. Don't come to me if you hit your head and feeling dizzy. You know, we got this problem recently quite a bit. Patients getting angry at us why we didn't see them. And my take is that you don't want to be seen at the urgent care if you have these problems. You're doing a disservice to yourself. Because if you have something serious going on, you wasted your time waiting for me, waiting in the lobby. It can be life-changing. I mean, life-threatening problem, you know, and you need to go ER. And a lot of the times they actually do for some reason.
Well, okay, this is the truth though, because I worked in family practice too, and I won't say which group it was because it happens to be one of the groups I love a lot. But the patients love their doctors. Everybody loves their individual doctors. They want to go to you, and they think you can solve everything. But this patient, and it wasn't with Dr. Hatemi's group, this was about 15 years ago, maybe longer. This patient came to our office. They were having chest pains. They wanted to see one of our doctors at that location. And they came in, and unfortunately, they went into cardiac arrest and died in our office. So that's why, if you're having chest pains, and I'm not a doctor, so I can't tell you about the radiation down your back and all that. I'll let him tell you that. But don't second guess it. Go to where you need to go.
Yep, go to ER. And, you know, if you have an orthopedic emergency, a lot of people do not know there are walk-in clinics. Prisma has one. And Midlands has a walk-in clinic too. I send a lot of patients there. After hours, they can see you and they can put you in a cast. You will save a lot of. So there's orthopedic urgent care specifically, and we can give you directions to go there after we do an X-ray, determine you have broken bones. You can benefit from there. We also availability with the hospitals. I can get you in with a specialist. I have connection with a cardiologist. I can get you in the same day or the next day. I have very good contacts with the orthopedic surgery group for shoulders and knees. I can get you see a surgeon very fast. We have good relationship with the ENT. He can see you in a couple days for major ear, nose, throat issues. I have a good friend who's a podiatrist I can get you in with. We have some contacts. We can get you in. But
lots of contacts.
These are for non-emergency cases. But for true emergencies, please take your child or your adult patient to an emergency room, especially children, you know.
Absolutely. And I'm going to go back to this one more time, too. If you have a chronic illness, unless you're in one of those plans that Dr. Hatemi is your HMO, Health Maintenance Organization primary care physician. You need to see your primary care physician because you signed a contract stating or giving you a primary care to see. You need to see that primary care because if you come to us, they may not pay us unless we have an authorization. And unfortunately, in urgent care, it's a lot different than a primary care. We don't have the staffing to do all this. We wish we did, but then our prices would probably be more, So we don't have that luxury of having that staff. So if you want to come see us, get on the phone, talk to the insurance company, and then when you come into our office, have them on the phone and say, hey, here, talk to this person up front, talk to one of our MOAs, because they're going to need an authorization number. A lot of times you call your primary care because it says in your contract you will contact your primary care before you see in somebody that's not your primary care physician.
And they do quite more time. And, urgent care setting, we see 60, 70 patients, sometimes 100 patients a day.
It was 120 plus.
120 plus. So, if you want me to sit down and talk to you for 10, 15, 20 minutes about your problems from 1985, it's not going to happen. Unfortunately, I just don't have the time to spend on that kind of issue. I mean, I have patients come emergency room and they're like, oh, in 1970, I had into this car wreck, and, in the 80s, I had this, and then 90s, I had this, and I'm like sitting there. It's like, why are you here? Let me take care of that problem. And then don't give me your life history because I cannot take care of like 50 different problems in one visit. That's a problem too. We don't get paid for that neither.
Yeah, and that's why go to your primary care. That's what they for. The relationships are different. Dr. Hatemi's relationship with you is on an urgent care basis, and he's going to take care of that urgent care need. Your family practice physician should have been seeing you for a while. They should have your entire life history. They should have your family's entire life history, so they know what to expect. I mean, I go to my primary care. I try not to go more than every 3 months because I don't like going to a doctor. So, but anyway, it's not because I don't like doctors, it's because I work in the field. But so they know your history. They know about you. Dr. Hatemi he's there to take care of your urgent need and not your chronic need.
I'm younger. I don't have a primary care doctor. I mean, that's because I'm a doctor too. But I get patients, they are like in their 80s and they don't have a primary care doctor.
What?
That blows my mind. I just don't understand that concept. Like, how can you be 80 years old and you don't have a primary care? And they say, I have nothing wrong with me. Well, you don't need
a doctor.
You still need a doctor. I mean, who's doing your regular colonoscopy? Who's doing your stress test? Who's doing your checkups for everything else? I mean, just because you are not getting checked doesn't mean you are healthy. I mean, and I don't get it. I don't understand that concept.
I would say what I've noticed recently, Dr. Hatemi, is that a lot of family practitioners and internists are no longer accepting new patients.
Yeah.
So I think that's where some of these patients are coming from. But at the same time, you need to find that provider. They're out there. You may have to search for them a little bit harder. Even ask your network that you're in, your insurance network, what primary care physicians or internists are actually taking new patients. And I feel for you there because I know where you're coming from, and I understand, especially being a senior citizen, I understand where you're coming from because thank goodness my primary care physician is also a doctor I used to work for in the past. So I guess I'm lucky because I have her.
Why do you think they are leaving practice? Why there's not enough primary care doctors?
I think the system's overwhelmed.
I agree.
And that system, though, has to do with the way things are ran in our government, state to state, federal to federal, and hospitals. Because when a hospital has all these practices, I'm going to say a thing or two here, have all these hospitals, for these practices they're buying up, they should make sure that somebody in their network is taking new patients. It's not right for a patient to sign up with a specific insurance and then they're being told, I'm sorry, we're in so-and-so network and we're not taking new patients. No, I understand networks being closed because networks can close to physicians. But I don't think it's fair when these big entities cannot help you find another provider to take care of you. That's not right. You need someone to take care of you. You need a family practice or an internal medicine physician to take care of your everyday needs. So if that's a problem, I'd be getting on the phone and calling some administrator at the hospital saying, you find me a primary care doctor.
It is I mean, I have a lot of friends who are doctors from different specialties.
Yeah.
I've never seen as miserable bunch as the family medicine doctors. They just hate their life. They're miserable. They want to quit. They want to retire. They are overworked because for the money
and underpaid. I'm going to say that.
They don't get paid for a lot of things. I mean, they're underpaid. And they have a huge responsibility. So they need to know everything. Like you go to your orthopedics, they only care about your bones. You go to your cardiologist, your heart. But you go to your family medicine doctor, they need to know everything about you. And the money they make for it is very little to nothing. And then they're like, and they have to make calls. They need to get your referrals, and they have to follow your blood work, and it's just a lot of responsibility.
And call and follow up too, literally.
And I mean, you can complain about it. You can say, "Oh, they are doctors; they signed up for it." Fine, you can complain about it as much as you want. But the reality is, if they're quitting, and they're not accepting new patients, and they're retiring or semi-retiring, you'll be all pay the price.
Absolutely.
For that. So, you might not care about it, but eventually they will make you care about it because it's going to come and hit us. And, that void is being filled by nurse practitioners and PAs. But, there is a whole different conversation on that department, we don't want to get into tonight. There was there's a big issue there. I mean,
and there's nothing wrong with nurse practitioners or PAs or whatever the case may be. But personally, if I'm seeing one of those PAs or nurse practitioners, I want to know they're under a doctor's supervision. That's just me personally.
Unfortunately, that's changing too. I mean, there's a minimal doctor supervision. A lot of states, they can work independently. There was an argument in California, that California sued a nurse practitioner because she was introducing herself as the doctor. But then her argument
happens a lot, especially with PAs. Have you noticed that? A lot of patients think a PA is a physician. They're not physicians. And that's just one thing to know. I mean, so that's why I'm saying if I'm going to see a nurse practitioner, which I have in the past, for a practice, again, I used to work for, because I don't think there's a practice in South Carolina I haven't worked for at some point in time.
True.
That I used to work for, that I love them to death, and I loved her. She was wonderful. In fact, I thought she was better than some of the physicians there. But at the same time, I knew that she had a doctor to go to in the event she didn't have the answer for my problem.
I mean, they have a doctorate in nursing, so technically, if you go very technical, they are doctors. But then in a clinical setting, I think it might be confusing to the patient when you call yourself a doctor.
Absolutely.
And physician assistants, PA, used to be physician assistant, assisting physicians. But they petitioned, and they didn't petition, I guess. They made a decision themselves to change their name. Physician associate.
Really?
Yeah. PA now stands for physician associate, and that's another flex, and they're trying to more get into the. I don't know. I'm not going to get into that. I think that's a little bit tricky situation there because you are misleading public.
Look at the education. Research it yourself. Look at the education that a PA is required to have versus a nurse practitioner. I'm just saying.
I mean, nurse practitioners, they're coming from nursing. they have a lot of patient care experience. Plus, they get the training on top of that. But PA is like straight out of school. And then, 2 years, 3 years degree,
I could be one.
Yeah, I mean, it gets a little tricky there, like it's kind of like what you're getting, like,
just ask questions.
Yeah, ask questions and be careful. Be careful. It's your life. You don't want to risk it.
I I'm old, but I still value my life.
I mean, there are good ones obviously out there. I'm not blanket blaming, but there's scary ones too out there. So you need to be careful what you're dealing with. But in that sense, they're filling a huge void in the primary care. I mean, there are very good nurse practitioners and PAs out there. I love nurse practitioners. PAs, I'm a little bit biased, but nurse practitioners are stepping in to fill that shortage of doctors in the primary care. So I think in about 5 to 10 years, almost all primary care doctors will be nurse practitioners.
They're going to have somebody, because with the rate that I'm hearing, and I'm part of MGMA, which is a large medical group organization that's nationwide, and from what I'm hearing, especially with doctors now turning patients away and everything, we've got to turn to somebody. We've got to have somebody there, and I do think that nurse practitioners will help fill that void as well as PAs, but I guess I'm a nurse practitioner advocate more so than a PA. That's just me personally.
I'm on the same boat. I mean, I have a nurse practitioner working for me. I have good friends that are nurse practitioners, but it comes to PA, it gets a little tricky.
Yeah, that's just a personal opinion. That's just my opinion. For whatever it's worth, but 48 years has been around the field. I think I know a little bit. I don't know a lot, but I know a little bit.
Well, you know, they fill the void, which is huge in the primary care. But you know, we also need more primary care doctors because our population is aging.
And they're not going to school though. They're not going. There's hardly anybody, enrolling to go to a primary care anymore.
I mean, medical school. You know, you think about going to like surgery or oncology or whatever, like a subspecialties.
Exactly.
Because of have student loans and you have to pay back, and quality of life, you know, primary care has
documentation and the coding, and my gosh, there's so many regulations. There's so many rules and regulations on a provider, and I can say this because I see it every day. The rules and the regulations and the stipulations that are put on these providers is unreal. I mean, they cannot. I try to keep up with it, and I'm not a doctor, so God bless them, because I can barely keep up with it. And I'm also certified in compliance. I'm a compliance professional. So I can tell you these rules and regulations, there's so much put on these doctors that it makes it almost impossible sometimes for them to do. They want to see you. They don't want to have to take care of this little stuff. They want to treat their patients. They want to make you happy, and they want to take care of you. This other stuff is so much on them. It's unreal.
I mean, it's getting very complicated, and we don't want to be burdened, unfortunately, the paperwork, the regulations, and insurance requirements. I mean, documentation, coding. I mean,
goodness.
And insurance companies become ridiculous. I mean, they're like, we don't pay this claim because your diagnosis code is different. I was like, well, I've been using this code for 5 years. Oh, we changed the rules last year. We want you to put this code instead of that code. I was like, why you change it? We want arbitrary.
And CPT and that's
CPT arbitrary. I mean,
they change. They can change the CPT codes. They can delete the CPT codes. They can change the ICD-10s, which is your diagnosis codes. The CPT is your services or your procedure codes, and they can change that. They can delete it. They can say this is not relevant anymore, or this code's not appropriate with this CPT code. It's just, you guys have no idea.
It's like it's like a game. It's like, oh, why you put sinusitis instead of acute sinusitis, or why you put wheezing but by letter. I mean, just like, oh my God. And it changes, like they keep changing. And I was like, why you change it? It's like, we want to change it because
they can do it annually.
They can annually, yeah, they change it. They're moving the goalpost constantly, and that crazy, I guess. Can you imagine if you have only one insurance for everybody? That's a dream come true. No, you know, a lot of jobs will be eliminated, right? Yeah. You won't have billing.
They will be eliminated.
They will be billing companies.
I'm not sure about socialized medicine, but I am for patients having insurance. But but I agree with you, Dr. Hatemi. I mean, to a point, but I'm not into socialized medicine. But I do think everybody should have health care. Yeah. I think everybody should be entitled to health care. Now, I do think if you abuse it, that should be also an issue. Okay?
I think you can have one insurance policy for all, but they are not free. If you have in you can afford it, then you get it on a free or discount. If you have a job, you can afford it, then you pay for a premium. If you're above 65, then you're a retiree, and then you pay according to that. I mean, it can be same insurance with different payment modalities.
Medicare is not even free. Medicare A is. Medicare B, and I'm still working, and I'm still paying Social Security on it. But it's not free. Mine costs me over $100 and something a month, and it comes directly out of my Social Security check.
And you know what else would be nice? I mean, in my home country of Turkey, you know, every health record is on one app. You can literally go to your cell phone and you can check your labs, your images, your doctor visits, I mean, everything. And it makes my life so much. Like, I have patients from overseas. They're like, oh, let me look at my medical record. They go to their cell phone, boom, boom. In 2 minutes, they tell me everything about it, and it's standard.
Yeah. And South Carolina is getting that way, but we're just slow.
We just throw
Well, the United States is slow in doing that. But we're trying to get to where we can all have the same medical record. And it's getting that way, especially with prescriptions, I think.
Yeah, prescriptions, there's a database now.
Once you put in a prescription, Dr. Hatemi will know if somebody else, if you've seen somebody else and they've given you that.
That's for more of controlled substances. Yeah. There's across the country, there's a database. So if you get a pain medications or anxiety medication from somebody, and you come to me asking me for the same medication or something similar, I can go to the database and I can boom, boom, in 2 minutes. Like, I can tell you, oh, you got this, you got that. No, you shouldn't be getting this. I can tell that. And that's actually legally obligated for me to check that database.
And that's where your medical records comes in. If we could do that with every medical record.
But if I can do it to your labs, I can do it with your doctor visit, that would be tremendous. I mean, it will eliminate a lot of duplication. We don't do things multiple times unnecessarily, and it will make doctors' job much easier. Absolutely. I don't know why we cannot get it. I think that's part of being a capitalist society. You know, we have different power centers who benefit from it. So, you know, some things don't happen even if it's the best interest of the patient and the society. Sometimes things don't happen because there's a monetary gain.
And it's also your EMR systems. If the EMR systems and the EHR, which is electronic medical records or electronic health records, what they need to be able to do is they all need to merge together.
Talk to each other,
right now they're not all of them are talking to each other correctly. So if they start merging together and talking to each other, that will make it easier for physicians to treat patients than it is now.
True. It's a big mess, but we are dealing with it on a daily basis. But healthcare, we try to do our best. Despite all the difficulties, we are here to take care of our patients. So hopefully this podcast has been helpful. Karen, do you want to add anything to this conversation? I'm going to
leave it up to you if you want to, if they have questions. And
if you have any questions on the comment section, you can put it in. And then, of course, depending on the questions you put in the comment section, we will probably have a follow-up podcast and then specifically to answer those questions you have in the comment section. So if you have any questions about this podcast, please ask underneath this video, and then we will try to address that in the next episode.
And thank you so much for allowing me to be here, Dr. Hatemi.
Thank you, Karen. Thanks for being our guest.
And I hope I help you guys out there, because the patients, I went into healthcare because my grandfather and grandmother were in healthcare, and I went in it because I had a passion. I have a passion. I went into nursing first, but I had a passion. And so I love my patients. I love healthcare. 48 years, who stays in it 48 years unless they love it? So thank y'all very much.
Thank you, guys.